What is patellar tendonitis? How can you know that this is the cause of your knee pain? And what current treatments exist to help you overcome it so you can get back to what you love to do? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Patellar tendonitis is a very, very common cause of knee pain in active people. Typically, it's a problem of people who jump a lot. Maybe it's basketball players or volleyball players, or people who run a lot, people who run marathons or maybe triathlons or track and field or cross country. This is an inflammation of the patellar tendon. So if this is the kneecap, you have the quad tendon above it, the patella tendon below the knee. And it's typically painful right at the very bottom of the patella and top of the patellar tendon, what we call the inferior pole of the patella. But it's a source of pain typically right there. Now, very commonly, it's pain just with activity, just with jumping, just with running. But it can get to be where it aggravates you even with daily activities, especially the longer it goes. So initially it's just with jumping, with playing basketball, or it's just with running, but then it starts to bleed into you're just walking from place to place or going up and down stairs. Now, you don't typically have any of the other signs and symptoms of a more serious injury. No significant knee swelling, no locking or giving way or catching inside your knee. It's just very localized pain in a very specific area with, again, running or jumping or some sort of repetitive sports and exercise activity. Now, fortunately, this is a condition that typically goes away as you start to limit that repetitive stress. So yes, short term, that's going to be usually a period of time out of that sport or exercise. People don't like that. The concern is not necessarily that by continuing to do that activity that you're going to make it worse necessarily. It's just that it takes that much longer to get better. So usually there's a short period of time that you try to rest your knee to take pressure off that patella tendon and get that pain to go away. Also, a lot of work with physical therapy can be very effective to help that recover, strengthening the muscles around the knees, muscles around the hip to take pressure off that patella tendon, but also sometimes they have modalities that potentially could help it heal. Cortisone and other injections in the knee are not typically needed for the tendinitis phase of this. In fact, cortisone would be very, very damaging. Yes, it might give you some temporary pain relief, but we know that steroids weaken the tendon and make it more likely to rupture. I would strongly, this is not medical advice, but I would strongly recommend to my patients at least not get cortisone shots for patellar tendinitis. Now, what can happen sometimes is that area of tendinitis, if it's a long-standing process, what actually happens is you get an area of tendinosis or tendinopathy at that area where it's not inflammation anymore, but that tendon actually has a small area of degeneration. That's where potentially different regenerative treatments, injections might be helpful. Something like a platelet-rich plasma, maybe even something like exosomes could help. Typically, again, very, very rarely, though, surgery is not needed. It's just a matter of getting that tendinitis to calm down. If it becomes a tendinopathy, though, and maybe regenerative treatments haven't worked, sometimes surgery can be necessary. You go in and basically cut out the diseased portion of the tendon and then close it back together. But that, albeit seemingly a minor surgery, can be very difficult to recover from. So you really want to get it better before it gets to this chronic pain, chronic tendinopathy or tendinosis state. So something like a penicillin polysulfate, again, not promoting experimental or off-label treatments. You read or watch much more in my other videos on this channel, much more about things like penicillin and platelet-rich plasma and exosomes and what experimental or off-label means. But in the case of penicillin, maybe an effective way to decrease the inflammation of that patellar tendon. In the case of regenerative treatments, once it becomes a tendinosis or tendinopathy, platelet-rich plasma, maybe exosomes might be helpful to get that tendon to heal. I am a big believer trying to get this to heal before it gets to the chronic pain, before it gets to something that typically needs surgery like a tendinosis or tendinopathy. Again, the vast majority of the people will not even get there. Just a little period of rest may be enough to get it better. But adding physical therapy, adding maybe some of the newer treatments might be helpful to get you over that faster and more reliably, get you back to your sport and exercise a little bit more quickly, a little bit better maybe than you were before. So definitely a lot of things to consider there. I'd love to hear about your experience with your knee injury, whether it's patellar tendonitis or something else. Leave those in the comments below this video. Just understand, I can't offer you medical advice, but I'll try to answer your question in a future video. Subscribe to my video channel, click the bell to be notified when I release a new video and when I start a live stream like my Ask Dr. Geier live shows. Now, if you have knee, hip, shoulder, or some other bone or joint pain, and you want to get significantly better in the next 30 days without cortisone shots, without physical therapy or surgery, you can learn more about working with me in the description below this video. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.